Has someone you love started showing small, almost hidden clues that something big is looming ahead? I'm asking because I've seen how easy it is to dismiss these signs, especially when we'd rather not confront the thought that our loved one might be nearing life's final stage. But the truth is, elderly bodies often sound the alarm months, sometimes a year, before the end arrives. It's subtle at first, a diminishing appetite, a vague disinterest in hobbies, or an unexplained shortness of breath that comes and goes. The heartbreak is we usually piece it all together only in hindsight, when it's too late to prepare or cherish those last months. That's why I'm here today, to point out 7 key signs that might appear when an older person is approaching their final year. Recognizing them could mean everything when it comes to offering better care, preserving memories, and ensuring their comfort and dignity. These signs don't necessarily guarantee they have exactly 1 year left, but they're like road markers that something fundamental is changing in their overall health. I want to stress that each individual is unique, and no checklist can replace medical advice. But these observations stem from real experiences, my own, my friends, and countless families who've opened up about their journeys. By tuning in, you'll be better prepared emotionally and practically, helping both you and your loved one navigate this delicate chapter. Let's begin. Before we dive into today's topic, do me a quick favor, hit the like button, subscribe, and make sure you turn on the notification bell so you'll never miss any new insights we share here. Sign number 1. Unexpected weight loss. Not long ago, I visited my aunt and noticed her clothes hung off her shoulders in a way they never had before. She insisted she was fine, just not as hungry lately. But there was a quiet alarm ringing in my head. I had seen research from 2023 indicating that a pronounced, unintentional weight loss in elderly individuals can be one of the earliest signals of a serious decline. When an older person starts shedding pounds without trying, it often points to deeper issues. The body could be processing nutrients less efficiently, and their organs might be slowing down. In many cases, appetite simply dwindles. Food no longer tastes the same, or they feel full faster because the digestive system is less active. There's also the possibility of underlying medical conditions, cancers, heart disease, chronic lung issues, that chip away at energy reserves. Even emotional factors like depression or loneliness can suppress appetite. We often think of depression as sadness, but in many seniors it surfaces as loss of interest in eating or socializing. Why does this matter so much? Because when muscles weaken and body fat depletes, the individual becomes more fragile, prone to falls, and vulnerable to infections. If you see a noticeable drop in weight, say they suddenly look frail, or you're tightening their belt by a notch every other month, it's time to take a closer look. That doesn't mean panic, but it does mean paying attention. Simple measures like small, frequent meals or nutrient-rich shakes might help. Ultimately, though, it's important to have a talk with a healthcare provider to see if something else is at work. Sign number 2, crushing persistent fatigue. Fatigue in the elderly isn't just being a little tired. It can feel like a heavy blanket pulled over every aspect of their life. Activities they once did without a second thought, tidying up the living room, strolling to the mailbox, or even engaging in a conversation for an hour, become exhausting. I remember one patient, a retired teacher, who used to conduct lively storytelling sessions for her grandchildren. Gradually, she started canceling those sessions. She'd say, "I just need to lie down," or "I don't have the energy today." Her family brushed it off at first, attributing it to normal aging. But this type of deep fatigue that doesn't relent, even after sleep, often signals the body is devoting its limited resources to critical functions. Recent geriatric studies highlight that an uptick in daytime sleep, coupled with a struggle to stay alert, can surface months before more obvious end-of-life signs. If your loved one constantly complains of exhaustion or starts sleeping much more than they used to, see if anything else has changed, like appetite, mood, or mobility. Fatigue can also indicate a heart or lung issue, reduced kidney function, or a host of other conditions common in advanced age. Instead of pushing them to keep active in the same way they always have, consider offering gentler alternatives, short, seated exercises or leisurely chats where they can rest. It's important to recognize the body may be winding down, so focusing on comfort and less strenuous activities can improve overall quality of life. Sign number 3. Diminishing interest in social interactions. This sign goes beyond mere tiredness. You might notice your loved one withdrawing from family events, forgetting to return phone calls, or showing little enthusiasm for what used to light up their spirit. A once talkative individual may now sit quietly, offering only a few words. From what I've observed, older adults in decline sometimes find socializing overwhelming, mentally, emotionally, or physically. Even if they don't have a formal diagnosis like dementia, cognitive resources may be stretched thin. Social gatherings demand a lot of mental energy, following conversations, remembering names, responding appropriately. For someone with diminishing reserves, it can be too draining. In some cases, fear of being judged for memory lapses or physical frailties leads them to pull back. This can look like depression, and indeed, clinical depression may be a factor. But it can also be the body's way of signaling a retreat from external engagement. If your family members start skipping birthdays, dinner invites, or other get-togethers, don't take it personally. Instead, consider meeting them where they are, maybe a short, quiet visit at home or a relaxed phone call with no expectations. I found that a gentle approach, "Would you prefer a short visit today?" opens doors of communication about how they truly feel. Sign number 4, frequent or lingering infection. One of the most striking patterns I've noticed with seniors nearing the end is how vulnerable they become to infections. A simple cold that used to pass in days might hang on for weeks, or a small wound on the leg might take forever to heal. According to a 2024 update from Gerontological Health Guidelines, the immune system typically weakens with advanced age, but significant drops in its efficacy can serve as an alert. Infections such as pneumonia or urinary tract infections can suddenly become serious. And sometimes the typical symptoms, fever, severe pain, or chills, don't present themselves clearly. Instead, the person might just appear more confused or fatigued, which means problems can slip under the radar. It's heartbreaking to watch repeated hospital visits or antibiotic regimens that don't fully resolve the issue. Pay attention to subtle signs, a lingering cough, unexplained confusion, or sores that won't heal. These clues can help you catch an infection early, which in turn might prevent complications. If your loved one seems to be battling frequent illnesses, a doctor might evaluate their overall health to see whether more supportive, comfort-focused care is needed rather than aggressive treatment. Sign number 5, changes in breathing and heart rhythm. Have you ever noticed an older person who appears to breathe effortlessly, then suddenly takes quick, shallow breaths or long pauses? This irregular pattern, sometimes referred to as Cheney-Stokes respiration, can hint that the body's systems are starting to wind down. The heart might not pump blood as vigorously, so circulation to the extremities diminishes. The hands or feet might feel cold. Even the lips or nose can take on a bluish tinge from low oxygen levels. This isn't always dramatic. It can creep up gradually. You might observe them becoming breathless after standing up or walking a few steps when they never had issues before. Or maybe they complain of dizziness more frequently. These symptoms could point to a decline in cardiovascular efficiency, common in advanced congestive heart failure or similar ailments. One gentleman I knew developed a persistent fluid buildup in his lungs. At first, he was just clearing his throat and coughing occasionally. Over a few months, the cough deepened, and he struggled to lie flat. He needed pillows stacked high to sleep. Recognizing this shift early helped his family transition him to palliative care, focusing on comfort measures. That supportive environment allowed him to breathe easier, physically and emotionally, for the remainder of his life. Sign number 6, body temperature and sleep pattern fluctuations. In recent years, more attention has been paid to the body's thermostat issues in the elderly. The hypothalamus, which regulates temperature, can become less reliable. You might find your loved one bundled in blankets on a warm day or sweating when it's relatively cool indoors. These temperature swings can be unsettling, but they're often a natural part of the final stretch. Sleep patterns can also turn erratic. They might sleep for 10 to 12 hours a day, wake up multiple times at night, or nap unpredictably throughout the afternoon. There's a strong link between these disruptions and the broader slowdown in bodily functions. The body may be prioritizing restorative processes at random times, leading to a patchwork of rest and wakefulness. Sometimes, families try to correct this by keeping them awake during the day so they'll sleep at night. While this might help some folks, for others nearing the end, forcing them into a strict schedule can cause distress. Let them rest when they feel they need to, and gently encourage activities when they show signs of wakefulness or interest. Sign number 7, a shift in emotional or spiritual outlook. Finally, let's talk about one of the more profound indicators, a change in the way they view life, relationships, or even mortality. Some older individuals begin speaking more openly about death. They might express a sense of peace and acceptance, or they might start reminiscing about the past, tying up loose ends, or offering guidance for loved ones who will remain. This isn't always a resignation. In fact, for many seniors, it can be a form of emotional release, a way to ensure that relationships are mended and final wishes are known. I've encountered people who suddenly decide to sort through old photos, labeling them for family members, or insist on sharing family recipes as if they're passing on an inheritance of memories. On the other hand, some individuals become withdrawn or fearful, grappling with regret or worries they never voiced before. Their emotional state might fluctuate rapidly, calm acceptance one day and anxiety the next. For caregivers, this can be emotionally challenging, but it's also an opportunity to offer a listening ear. Ask about their hopes, regrets, and anything they'd like to discuss. You might be amazed at how such conversations bring you closer during this final leg of life's journey. What to do when you spot these signs? I know it can be overwhelming to realize that someone you cherish is exhibiting 2 or 3, or even all of these signs. The point is not to panic, but to prepare. Arm yourself with knowledge by talking to healthcare professionals, whether it's a geriatrician, palliative care nurse, or counselor specializing in end-of-life matters. If you're worried about infections, set up a routine for checking their temperature or monitoring changes in confusion. For breathing difficulties, consult a doctor about using supplemental oxygen or adjusting their sleeping position. Equally important is the emotional and practical side. If your loved one is receptive, discuss their advance directives, wills, or funeral preferences. This isn't morbid. It's a compassionate step to ensure their choices are honored. You might also suggest revisiting cherished hobbies in a scaled-down version. If they love gardening, maybe help them plant a few small herbs indoors. If they adore reading, choose shorter stories they can enjoy without getting too tired. Personal reflection, balancing hope and acceptance. I've walked this journey with several people close to me, and I know the tightrope walk between holding on to hope and facing reality head-on. It's possible to do both. You can remain hopeful about having meaningful moments, whether it's a pleasant conversation, a favorite meal, or a shared laugh, while also acknowledging that life's final stage might be around the corner. Give yourself permission to feel everything: sadness, fear, love, nostalgia. Your loved one might be struggling to come to terms with these same emotions, and seeing you take care of yourself can be reassuring for them. If you need help managing your own stress or grief, consider talking to a therapist, a spiritual advisor, or a trusted friend. Why these signs matter: creating meaning in the final year. The hardest part for many families is realizing that time is more limited than they hoped. But noticing these signs early allows you to make every day count. That might mean scheduling cherished family visits, helping them complete a personal project, or simply sitting quietly by their side. By recognizing the body's signals, you can shift from denial or frantic medical interventions to a more calm, compassionate presence. You can also cultivate precious moments of intimacy. Record your loved one telling stories from their childhood. Help them write letters to friends or relatives they haven't contacted in a while, or create a comforting ritual like sipping tea together in the late afternoon. These small gestures can become lasting memories, ones you'll treasure long after they're gone. A word to caregivers and family members. Please remember, you are not alone, and it's okay to feel uncertain. Caring for someone in their final year can be both exhausting and deeply meaningful. Seek out support groups, local or online, where you can share experiences and gain insights. It helps to talk to others who've been through similar trials, learning from the collective wisdom of a community. Self-care isn't a luxury, it's essential. Whether that means asking a neighbor to stay with your loved one for an hour so you can run errands, or setting up a weekly call with a friend just to vent or cry, make sure you don't neglect your own needs. Burnout doesn't serve you or the person you're caring for. Final thoughts. We've covered a lot here: unexpected weight loss, persistent fatigue, social withdrawal, frequent infections, irregular breathing, temperature and sleep pattern fluctuations, and a shift in emotional or spiritual outlook. Each sign can be subtle, often mistaken for routine aging or dismissed as a temporary phase. But taken together, or if any one of them is especially pronounced, they often point to a deeper change preparing the body for its final transition. If you find that these insights resonate, or if you're seeing some of these signs right now in someone you love, take heart in knowing that recognition is the first step toward making this final chapter meaningful. Talk to medical professionals, involve a palliative care team if appropriate, and above all, be present. Simple acts of empathy, kindness, and attentive listening can transform a difficult time into one that feels rich with purpose and love. Thank you for taking the time to read this. If anything here felt familiar or gave you a new perspective, I encourage you to share it. Leave a comment, maybe mention which sign hit closest to home, or subscribe so you won't miss future content about elder care, emotional well-being, and navigating life's most challenging transitions. Your willingness to confront these truths now could save you and your loved ones from future regrets. It can help you focus on creating comfort, understanding, and heartfelt connections in the days or months that remain. Because in the end, it's not about how many days we have, it's about how we fill them with compassion, dignity, and love. If this content helped you, please like this video, subscribe, and turn on the notification bell. That way, you'll never miss future updates, and you'll help our community reach more people who need this support.